Hello, what brought you to ER tonight?
I was sleeping. I woke up, and I couldn't breathe.
Hello everyone, I am Leftlateral. Welcome back to our channel. Tonight, we are going to be talking about morbid obesity. I am an X-ray tech on the deep night shift. Working in a hospital, I see many obese patients. The obese patient of the opening has a typical condition of sleep apnea. Sleep apnea. Obesity can cause a narrowing of the airways, leading to sleep apnea, a condition in which a person repeatedly stops breathing during sleep. Obesity is not a manageable disease for everyone. Many healthcare providers and doctors struggle with addressing weight issues with their patients. However, it is important to remember that obesity is a complex condition often rooted in biological, psychological, and social factors. Simply telling a patient to lose weight can be dismissive and insensitive, and may not effectively address the underlying issues contributing to their obesity. Instead, healthcare providers should approach the issue of obesity with empathy and compassion, recognizing the challenges and barriers that their patients may face in managing their weight. This can involve a collaborative approach that considers the patient's individual needs and goals. Yes, we healthcare professionals have been doing those. The reality is that many nurses and technologists injured their lower backs by lifting obese patients. Other difficulties are limitations. Man-equipped hospitals lack the proper equipment to properly treat and care for obese patients. Standard hospital beds, wheelchairs, and operating tables are often not designed to accommodate patients who are significantly overweight, which can make it difficult to move and position patients and can put additional strain on staff. Complications during procedures. Obese patients are at increased risk for complications during procedures, including respiratory distress, wound infections, and blood clots. These complications can be difficult to manage and can lead to more extended hospital stays and higher healthcare costs. Difficulty with mobility. Obesity can significantly limit a patient's mobility, making it difficult for them to move around the hospital and get the care they need. This can strain hospital staff, who must help patients move and position themselves. Increased risk of pressure injuries. Obese patients are at increased risk of developing pressure injuries, which are painful skin and tissue injuries caused by prolonged pressure on one body area. These injuries can be difficult to treat and can lead to prolonged hospital stays and increased healthcare costs. Besides hospital challenges, obese patients may have cardiovascular disease. Obesity increases the risk of heart disease, stroke, high blood pressure, and other cardiovascular diseases. Type 2 diabetes. Excess body fat, especially in the abdominal area, can increase insulin resistance, leading to type 2 diabetes. Cancer. Obesity has been linked to an increased risk of several types of cancer, including breast, colon, endometrial, and kidney cancer. Sleep apnea. Obesity can cause a narrowing of the airways, leading to sleep apnea, a condition in which a person repeatedly stops breathing during sleep. Osteoarthritis. Obesity can put additional stress on the joints, especially in the knees, hips, and lower back, leading to osteoarthritis. Liver disease. Excess fat in the liver can lead to non-alcoholic fatty liver disease, which can cause inflammation and scarring of the liver. Gastroesophageal reflux disease, GERD. Obesity can increase the risk of GERD, a condition in which stomach acid flows back into the esophagus, causing heartburn and other symptoms. Kidney disease. Excess body fat can strain the kidneys and increase the risk of kidney disease. Depression and anxiety. Obesity has been linked to an increased risk of depression and anxiety, possibly due to the physical limitations and social stigma associated with the condition. They often ask me what I usually eat since I am always slim and healthy. I eat mainly Japanese food that is locally available. The Japanese food I eat is very simple: rice, miso soup, and natto. My Japanese food keeps me healthy. If an obese person in the USA wants to start eating a Japanese-style diet, here are some tips to help make the transition. Focus on whole, unprocessed foods. Japanese cuisine emphasizes whole, unprocessed foods, such as rice, fish, vegetables, and soy products. Try to incorporate these foods into your diet and limit your intake of processed foods and sugary drinks. Increase your seafood intake. Fish and other seafood are a staple of the Japanese diet and are a good source of omega-3 fatty acids. Try incorporating more fish and seafood into your meals, and consider using it as a protein source instead of red meat. Incorporate fermented foods. Fermented foods, such as miso, natto, and pickled vegetables, are a staple of the Japanese diet and are rich in probiotics and other beneficial nutrients. Try incorporating these foods into your diet in small amounts. Experiment with tofu and other soy products. Soy products, such as tofu and edamame, are a staple of the Japanese diet, and are a good source of plant-based protein, fiber, and other nutrients. Try incorporating these foods into your diet as a source of protein. Try new cooking methods. Japanese cooking often involves grilling, boiling, or steaming, low-fat cooking methods. Try using these methods to cook your meals, and avoid high-fat cooking methods such as deep frying. Drink green tea. Green tea is a staple of the Japanese diet and is a low-calorie, nutrient-rich beverage. Try incorporating green tea into your diet as a healthier alternative to sugary drinks. Reduce portion sizes. Japanese meals tend to be smaller in portion size, which can help control calorie intake and prevent overeating. Try reducing your portion sizes and paying attention to hunger and fullness cues. It's important to remember that changing your diet can be a gradual process, and taking small steps toward your goal is okay. Also, it's always a good idea to speak with a healthcare professional or a registered dietitian before making any significant changes to your diet. In closing, the traditional Japanese diet, which emphasizes fresh, whole foods and portion control, has been proven to be a healthy and effective way to maintain a healthy weight. It's a model that the United States could certainly benefit from, as obesity continues to be a growing problem in this country. By embracing the principles of a healthy Japanese diet, we can work towards reducing obesity, improving our overall health and well-being, and setting a positive example for future generations. Thank you for your viewing. How did you like this video? Let me know what you think about this video in the comments. If you like this video, please give me a thumbs up and subscribe to the channel.